Hi everyone, my name is Yvonne Mensah. Today we are going to take a fascinating journey talking about two infections, filariasis and pericarditis. Filariasis caused by worms and pericarditis caused by bacterial. We will look at everything from their causes and symptoms to treatments, prevention, and real life case studies. By the end, you will see just how different and sometimes surprising these diseases can be. Don't worry, I promise no worms will crawl on you during this presentation. Okay. Filariasis is caused by a tiny but mighty worm called Woraeh bankruptcy, a nematode from the family Onchocercidae, and affects millions worldwide. Despite its size, it can cause huge problems in the lymphatic system. Imagine a worm so small it can fit in a mosquito bite, yet it can disrupt your whole lymph system. The bacterial pericarditis pathogen description is caused mainly by Staphylococcus aureus, the same bacteria that can cause skin infections, but here it targets the pericardium, the protective sac around the heart, which can be life-threatening if untreated. The filariasis morphology. Woraeh bankruptcy worms are thread-like. The adults are cylindrical and pale, while their babies, called microfilariae, float around in your blood like tiny invisible swimmers. Pretty creepy, but also fascinating from a biology perspective. We're going to look at the bacterial pericarditis morphology. Staphylococcus aureus are tiny round bacteria, gram-positive cocci that like to cluster together like grapes. They can have a slimy capsule that helps them sneak past our immune system. Okay. Sure. Now to the transmission of filariasis. Filariasis spreads through mosquito bites. The usual suspects are Culex, Anopheles, and Aedes mosquitoes. Once the larvae are in your bloodstream, they make their way to the lymphatic system and grow into adult worms, sometimes blocking the lymph flow. Oh, raise your hand if you've ever been bitten by a mosquito. Now imagine it's carrying a tiny worm. In Africa, and I am an African, I have been bitten by mosquitoes and it's not a good thing. It makes you really sick. It can cause malaria, making you feel like very hot, the next minute very cold. It is not a good feeling at all. So imagine that. And the transmission of the bacterial pericarditis. Bacterial pericarditis usually spreads from the bloodstream, nearby infections, or even during surgery if sterile techniques aren't perfect. Basically, bacteria take a shortcut straight to the heart, just straight to your heart. And the signs and symptoms of filariasis, many people don't even notice at first, but some develop swelling in their limbs, elephantiasis, like what we're seeing on the slideshow. One leg is way bigger than the other one, and it's like a silent invader causing damage before you know it. The signs and symptoms of pericarditis include fever, chest pain, shortness of breath, and fluid accumulation around the heart. Imagine feeling pressure in your chest that just won't go away. Imagine that. It's serious and needs immediate attention. Disease progression, filariasis. If untreated, chronic lymphatic damage can lead to elephantiasis and severe disability. Secondary infections often sneak in, making life very difficult for patients. The disease progression for pericarditis. If left untreated, it can lead to cardiac tamponade, septic shock, or even death, the worst of it all. This shows how quickly bacterial infections around the heart can become life-threatening if left untreated. Treatment: filariasis. Filariasis is treated with medications like the DEC, albendazole, or ivermectin. Chronic cases may need surgery or special care for swollen limbs. The worms are stubborn, but modern medicine can manage them. Treatment for pericarditis. This one is urgent. It requires draining the fluid with a procedure called pericardiocentesis and strong IV antibiotics like vancomycin or ceftriaxone. Prevention, or how to prevent filariasis. Preventing filariasis focuses on mosquitoes, controlling their breeding, using insecticide, treated nets, and giving mass medications in areas where the disease is common. Bacterial pericarditis prevention. Preventing bacterial pericarditis is all about hygiene and early treatment. Treating infections promptly, keeping surgeries sterile, and using preventive antibiotics when necessary. Epidemiology for filariasis. Over 657 million people are at risk worldwide. 51 million infected as of 2018. Thankfully, mass drug progress have reduced infections significantly. Thankfully. Epidemiology for pericarditis. This disease is rare today thanks to antibiotics and vaccines, but it can still happen in places with limited medical care like Ghana, Cote d'Ivoire, Senegal, the West African countries. Yeah, it is rare, but it can still happen in places with limited medical care. Distribution of filariasis. Endemic regions include tropical Africa, Asia, and the Pacific, especially India and Bangladesh. Mosquito-friendly climates make it easy for the diseases to spread. Distribution of bacterial pericarditis. More common in developing countries where access to antibiotics and sterile medical procedures is limited. Prevention really is key here. Case study for filariasis. In India, mass drug campaigns reduce microfilaria prevalence from 10% to 0.5% in 8 years. A real success story showing how public health measures can change lives. As we are seeing the image over there, that's like an elephantiasis with one leg that big. Bacterial pericarditis, a case study of it. A patient with bacterial pericarditis fully recovered after pericardiocentesis and antibiotics. The source: untreated pneumonia. Quick treatment saves lives. We should always try to have the treatment quickly done in order to avoid the worst of it all being death. Interesting facts and references. Did you know that filariasis can silently damage the immune system before the symptoms even appear? And bacterial pericarditis used to have nearly 100% mortality before antibiotics. Medicine really has changed the game. So worms or bacterial, both can teach us a lot about infections, prevention, and the power of modern medicine. Okay, now these are the references for my PowerPoint presentation, and these are questions I have for you. What causes filariasis? Which bacterial mainly causes pericarditis? How is filariasis transmitted? Name one common symptom of bacterial pericarditis. Give one way to prevent filariasis. Like I said, worms or bacterial? Which one surprised you more? Is it worms or the bacterial? And as I promised, no worms crawled up on you. Thank you for watching and listening. I appreciate. This is Yvonne. Thank you so much. Bye-bye.